Good afternoon, everyone. Today, I'm going to present a paper on role of B-scan ultrasonography to evaluate posterior segment pathology in patients with opaque media. Conflicts of interest are nil and no financial interest. Introduction: ultrasonography is one of the most useful non-invasive techniques for evaluation of posterior segment of the eye. Baum and Greenwood developed the first brightness mode scan in ophthalmology. Introduction of first commercially available B-scan was by Coleman and Associates in early 1970s. Thereafter, Bronson introduced a portable contact B-scan machine for ophthalmic use. Aim: to evaluate posterior segment pathology using B-scan ultrasonogram in patients with opaque media posted for cataract surgery. Materials and methods: a prospective study was carried out from October 2022 to Jan 2023. 100 patients with dense cataract posted for cataract surgery were included in the study based on the predefined inclusion and exclusion criteria. A proper informed consent was obtained and ophthalmic examination was carried out. Inclusion criteria was age more than 40 years, both the genders, and no other media opacities due to anterior segment pathologies. Fundus cannot be viewed by ophthalmoscopy. My exclusion criteria were aged less than 40 years, any media opacities due to anterior segment pathology, and if fundus can be viewed by ophthalmoscopy. Patient evaluation: detailed history was taken and examination was done in all the 100 patients with dense cataract posted for cataract surgery. Visual acuity, slit lamp examination, and intraocular pressure were recorded. Procedure was explained to the patient for their cooperation. B-scan ultrasonography was done in all the 100 cases with a probe using direct contact method with the patient in supine position. After applying gel over the probe, it was placed over the globe of closed eye. Axial, longitudinal, and transverse views of B-scan were taken. High gain and low gain sensitivity was selected during the procedure and images documented. Observations and results. Age: in this study, most of the patients of 45% were in the age group of 61 to 70 years, and most of the patient was females, contributing to 55%. Laterality: most of the patients had dense cataract in right eye, 52%. And vision: most of them presented with a vision of hand movements followed by perception of light, then counting fingers close to face, counting fingers 1 meter, and the least was counting finger 2 meters. Pupillary assessment: 92 patients had normal pupil, while 3 had RAPD, 3 had sluggish reacting pupil, and 2 with synechiae. And in this study, most of the patients had mature cataract, about 60%. IOP: most of the patients had an IOP of 32 patients, and the least was 1 patient with 22 millimeters of mercury. B-scan findings: 58 patients had normal B-scan, followed by 16 patients with vitreous degenerations and 14 with PVD, 4 with retinal detachment and asteroid hyalosis, 3 with PVD with vitreous degenerations, and 1 was with vitreous hemorrhage. And this is a picture showing nuclear sclerosis grade 4, mature cataract, hypomature Morgagnian, complicated cataracts. And this is the pictures of B-scan showing normal and then vitreous degenerations, PVD, asteroid hyalosis, fractional retinal detachment, PVD with vitreous degenerations, and vitreous hemorrhage. Discussion: in this study of 100 patients, highest were in the age group of 61 to 70 years and the least in the age group of 41 to 50 years. Most of them were females, and 52% had dense cataract in right eye, 40% in left eye, and 8 had in both eyes. Highest percentage had vision of hand movements and the least had counting fingers at 2 meters. Highest had the mature cataract and least was a traumatic cataract. 58% has normal B-scan findings, followed by 16% with vitreous degenerations. 14% has had PVD in my study, which is compared to a study by Qureshi in which 3% had PVD. And 4% had retinal detachment in my study, compared to a study by Blumenthal, which had 4.5% retinal detachment. And 4% had asteroid hyalosis, which is compared to a study by Qureshi, which had 2% had asteroid hyalosis. And 3% had PVD with vitreous degenerations, and 1% had vitreous hemorrhage, compared to a study by Salmani, where 1.7% had vitreous hemorrhage. Conclusion: ocular B-scan is a safe, non-invasive technique, and in patients with dense cataracts, posterior segment can be visualized by ophthalmoscopy, and there is also a risk of poor visual prognosis in patients with cataract who may also have coexisting posterior segment abnormalities. In these situations, B-scan ultrasonography is a great method of assessing posterior segment of the eye. These are my references. Thank you.
So you are a postgraduate?
Yes, sir.
Which year?
Second year.
Second year, okay. Nice presentation, nice collection of data. But what was the need for the study?
So,
See, when you come up with a thesis topic, you have to write the gap in the knowledge. You have to do a literature search, and there will be a gap in the knowledge, and then you form a research question, form an hypothesis, then you come across your thesis topic, right? So what do you think was a gap in the literature? So why was this study needed?
to explain the need of B-scan ultrasonography with dense cataracts going off for a cataract surgery.
Is it not? Is there enough literature available in this regard?
Yes, sir.
Or is it not a practice that whenever there is a media opacity, you do B-scan? It's there, right? So whenever you choose a research topic, it should be something. I agree. As a postgraduate, your intention is to first get done with your thesis and not fall short of the number of cases which are needed. I totally agree with that. I have gone through that. But then you should make an attempt to make some, go a little step ahead and then do a little with the available infrastructure.
Yes.
Okay, thanks.